What is your name, your occupation, and where do you work?
My name is Lori Cassidy Murphy, and my occupation is the Director of Development and Special Projects for the Medical Association of Georgia.
Could you tell us a little bit more about what the Medical Association of Georgia does?
Well, essentially, to kind of tidy it up, put it in a nutshell, the bread and butter of MAG is primarily as the physician's legislative arm. We are the voice for physicians in Georgia. We have about 8,400 members. It is voluntary to be a member of MAG. You do not have to be a member of MAG if you're a physician in Georgia. We just encourage that our physicians, or that Georgia's physicians, join the Medical Association of Georgia because of the advantages, like being completely, on the up and up when it comes to any legislation that is going on in Georgia that would affect physicians, patients, etc. So, we're here to really look out for their profession and ensure that they are very well represented in terms of their voice being heard on things like scope of practice, to ensure that like other specialties or other clinicians are not coming in and, trying to take over the jobs or the duties of a physician that has been trained to do specific things, through their med school and residency, et cetera. So that's the big thing, is the legislative and, our policy and ensuring that we're there for them to protect their practice and to protect their profession. However, one of the jobs that I do in conjunction with special projects for MAG is that I'm also in charge of the foundation's Think About It campaign, which is a prescription drug prevention initiative, which is how I got involved with IPRCE.
Okay. What are some of your day-to-day tasks or roles in this position?
Primarily, what I feel like my main role is to ensure that the physicians are up to date as to, and also their colleagues, other clinicians in their offices, because the physician cannot do everything that a physician needs to do in terms of keeping track of all of the latest and what they have to do in terms of checking databases and ensuring that everything they're doing is correct. So it's a team effort. But my job primarily is to ensure that those physicians that are prescribing Schedule II and higher, but really any physician who is prescribing, to just make sure that they are aware of all of the laws, rules, policies that are in effect for this particular issue of prescription drug abuse prevention and substance abuse disorder. So, because so many things have changed in our world over the last several years, thankfully MAG was ahead of the curve on this, and we started an initiative. We started an initiative with Think About It several years ago. So we were ahead of it, but as things have come down the pike, especially when it comes to physicians and what they are permitted to do, that's where we step in and just make sure that they are covered and that they're aware of what their patients need, obviously, but what they need to know to protect themselves.
Mm-hmm. And Lori, can you tell us a little bit more about the Think About It initiative?
Yeah, sure. Think About It started in, we started Think About It in, 2013. And it started out as kind of a everything for everyone type of initiative, which was way too much. And we learned that very quickly, that we couldn't be everything for everyone in terms of the general public, the physicians, the support staff, et cetera. So so, you know, we started out as just kind of a, you know, public outreach about making patients and physicians aware that, you know, this is an issue and that we need to be cognizant of how we're prescribing, that we need to start having conversations with patients about substance abuse disorder, etc. So very kind of vague at the very beginning, and then we started jumping into the naloxone space, where we got a grant through a fundraiser with Northeast Georgia Medical Centers Foundation, and we raised, I'm sorry, I can't remember how much we raised, but anyway, we raised enough money to supply many first responders in Georgia with naloxone. We purchased naloxone for them, and we had it shipped directly to them so that they would have it. So that was kind of we were the first group to do that in Georgia, which was awesome because it really spurred the fire for so many people to get on the bandwagon for that. And then, so that was called Project Dan, Deaths Avoided by Naloxone. And so then after that, those grant funds ran out. And we also realized that so many other people were moving into that space with harm reduction. It was really a good time for MAG to step out of that and then move into more prevention education and how to effectively ensure that physicians were aware of what they need to know, what they need to do. The laws with the PDMP began to take effect with, you know, mandating that physicians check the PDMP before prescribing a Schedule II, and, you know, rolling all of that out. And then just ensuring that anything that had to do with prescribing, that they were abiding by the laws or any mandates.
Wow, that's incredible, Lori.
It's exciting. I mean, you can really feel like, or I feel like, you know, it's made a difference, you know, like what we're doing is making a difference. Some of it has been very difficult for anyone, you know, to come around and do this, but it's difficult for physicians because they are so busy, and you know, they're the ones that the patient needs to talk to, and they need to talk to them, and that, you know, relationship is extremely important. And so now we're learning more about bridging the stigma gap and learning how to talk, you know, to patients about what may be going on in their lives without, you know, accusing or demeaning, but just letting them know that the physician's job is to look out for their safety. I mean, patient safety, right? And so that's the main goal. And so when it comes to, you know, co-prescribing naloxone or just talking to their patients about the importance of them being, you know, cognizant and careful with their prescriptions in terms of storage and disposal, et cetera. So it's become a longer conversation, but it's also become a very effective tool in the physician's toolbox, I feel like.
That's excellent. I don't want to hog up the interview, but I also wonder how your work is different in large cities like Atlanta and Savannah, and what it may look like in some of the more rural areas like Tifton's and the smaller towns across the state of Georgia.
Yeah, well, that is, you know, that is interesting, and it is a balance, because all of our doctors, you know, have been affected by this in one way or another. And so, yes, we have to ensure that we are reaching out to rural communities as well as suburban communities and urban. I think that with our work through the Department of Behavioral Health and Developmental Disabilities, we've learned through some of those more rural areas that, you know, per capita, you know, population and all that, of course, has an effect on this, but those smaller areas are affected tremendously harder. They're hit hard with this just because of the lack of jobs, the lack of entertainment and
Yeah.
diversion, and so we've just learned through time that people that are bored, and if they've already been through some sort of an addiction or
Yeah.
a hard time, that those people in those rural areas really have a more difficult time bouncing back.
Yeah. Yeah. Okay. Alicia, I'm sorry.
No, that's okay. What excites you most about your occupation?
Um, I really, I mean, there's so many things that I have learned and been so honored to be a part of in this space, and that includes our work with Sharon at IPRCE and Jonathan. I mean, I just love being in the environment with them because I just feel like I'm a sponge. If I wasn't so old, I would be able to retain that information a lot a lot better. But it's just every time I'm around either of them or Elena Stack, I learned something new, and it's just brought in everything about what what we do, and what then I can then take to the physician population in Georgia and tell them that this is what is going on here. This is what's happening, because there's obviously no way that they're going to know everything, and unless somebody like me makes it a priority for them, it's not going to be, it's just not going to matter as much. I mean, they may know it and they'll shrug it off, or they'll see something and be like, okay, I need to do this. But unless we really stand out and make I guess promote really what we're doing and the good that we're trying to do, and trying to understand it from different perspectives, I think that that's been a great accomplishment for me, to be able to do that, to be able to effectively communicate with them and ensure that they are fully aware, on all sides of it.
It's awesome. All right. So we have a certificate program at Emory. It's the
Mhm.
Injury and Violence Prevention Certificate. The purpose is to enhance graduate education and prepare students to become leaders of injury and violence prevention within their chosen discipline. So what would be your advice to someone who's considering the certificate program?
Again, being part of this collaborative has shown me so many different aspects of what is being offered for students, and it's just amazing to me, and I'm quite envious of all of you who get to have to possibly participate in some of this, because the people that your peers, the individuals that run this program really know what they're doing, and it's just such an effective program. And you have the name of Emory anyway, so you're already up there, and with respect, and people wanting to know about it. And so the different aspects of it that I've also come to learn when it comes to all of the different areas that you all are touching with domestic abuse, child abuse, different types of injury prevention initiatives that we all need to know about, because it all goes back to patient safety. And that's what we want to do. We want to keep people out of the hospital. We want to keep people out of the doctor's offices, and keep them healthy. And I think that just the way that you all go about promoting your initiatives is phenomenal. So kudos to anyone who can be part of it, and to you all too.
For the students that watch this video, Lori, that are interested in your line of work and what you do in your profession, what type of advice would you give to those students who find a lot of interest in what you are doing?
Well, I think that, given what I've been able to do, and looking back at how I wish that I could kind of, turn the clock around a little bit and change some things with how I came about to end up, at MAG. But, definitely, studying in public health and getting into anything you possibly can in working with state agencies, because so much of what we do has to do with public health, and there's so many people needed in that arena. There's just not enough people to do the work that needs to be done. And so if you can offer any sort of assistance there, I would say jump into that with, a program like IPRCE, or with Emory, or with DPH, or again, like with the DBHDD. But it just also helps to be a bit of a juggler, and managing many moving parts, because I run other programs that have nothing to do with prescription drug abuse prevention, so I have to really wear, different hats all the time. And as we grow, and especially in this arena of, public health, many people are doing the same thing. So you have to be flexible, and but again, just get in there and hone in on and take all the information you can from people who have been down this road, and feed on that.
If you're interested in applying to the IVP certificate, then email Dr. Dorian Lamis. You can also learn more about the certificate by visiting us on our website or social media.